Good afternoon, everyone. I'm Daniel, and my thesis title is Novel Approaches in Optimizing Bone Health. Me and my team are working on improving post-fracture care. I'm a first-year PhD student here at CTM and a fourth-year orthotrauma resident at the Department of Traumatology at Semmelweis. My supervisors are Peter and Zoltan, and my SME and SMS are Marie and Amir. One of the main reasons why I chose this topic is that I obviously love to operate, but it is also quite crucial that we don't look at patients as skeletons. So recovery is a very important topic. And this is why my vision is to have effective healthcare practices for maintaining optimal bone health and patient recovery. And my mission is to identify the most effective practices and protocols to achieve this vision. We currently have 3 ongoing projects, mainly focusing on the first one, which involves physical training in post-fracture patients. We have the second project, which looks at the same population, but from a nutritional supplementation point of view. And the third one aims to be a clinical trial protocol, building on the findings of the first 2. So the first project title is Investigating the Safety and Efficacy of Physical Training in Post-Fracture Patients. Why is this topic important? Why should you care? Well, the huge number of the population is affected by musculoskeletal diseases. And looking at fractures specifically, we still have to this day very severe consequences, including death. And many patients never return to pre-fracture function. So looking at these facts, it is quite obvious that this field needs a closer look and much improvement. And why physical training? Well, physical training is considered a magic bullet by many fields because of its numerous health effects, positive health effects. And we would like to investigate these effects on a very fragile patient group that is immobilized. And immobilization can lead already in the first few days to severe bone mass loss and muscle strength loss. So we asked the question, does physical training cause change in clinical outcome markers in post-fracture patients? We chose the PICO framework for our approach. Our population is post-fracture patients. Our intervention is physical training, including progressive resistance training, high interval training, and many others alike. And our comparator group is no physical training or standard of care, range of motion, mobilization, and our outcomes would be clinical outcome markers. We hypothesized that training positively affects this patient group with the clinical implication of improving recovery and reducing mortality. We have this search key with 3 domains. We have a fracture domain, a training domain, and a publication type domain. We only looked at randomized controlled trials. With this search, we found around 3,000 articles in these major databases. We followed the PRISMA flowchart selection protocol, and after the duplicate removal, the title abstract selection and full text selection, we also checked the citation chaser, and we arrived at 195 articles. The data extraction proved to be quite challenging. We had many rounds with the statisticians, so we consulted often. And we are currently still ongoing, the data extraction is still ongoing, and we're taking a focused and measured approach. So with our first project, we are finishing up the data extraction, hopefully in the next coming days. And we really hope to jump into risk of bias and figures. And I would really love to present them the next progress report. And of course, the deadlines are always in our heels. So let's jump to the second project. It is investigating the safety and efficacy of nutritional supplementation in post-fracture patients. Why is this important? Why is nutrition important? We can see that even in developed countries, this fragile group of patients is affected severely by vitamin deficiencies. If we look at proteins, it is also quite a high number. And if we look globally, there is also micronutrient deficiencies plaguing our world. So it is known that vitamin D deficiency affects us quite severely in a negative way, also including elevating the fracture risk. So we would like to investigate its effect on post-fracture patients. I mean, nutritional supplementation's effect, of course. And we asked the question, does nutritional supplementation cause changes in bone-related markers and clinical outcomes in post-fracture patients? Here we also chose the PICO framework with the population being the same. And the intervention is the nutritional supplementation, including vitamins and micronutrients, more specifically. And our comparator is no nutritional supplementation or standard of care. And we will be looking at clinical and bone markers. We hypothesized that nutritional supplementation will positively affect this patient group. And this would also have the implication of improving recovery and reducing mortality. So we have this preliminary search key, which we can consider finalized. We borrowed the first one and the last domain from the first project, and we have a nutritional domain, the vitamin and microelement domain. And with this search, we have around 8,000 potential articles from these major databases. We are still in the feasibility phase with the first project, but we're really hopeful of stepping to the next and registering our Prospero very soon. And I would also like to mention my third project, which aims to be a clinical trial protocol, and its title is Investigating the Safety and Efficacy of Nutritional and Exercise Interventions on Mortality and Hip Fracture Patients. We would like to ask the question, does implementing a novel evidence-based protocol improve the mortality and hip fracture patients? We would also aim to choose the PICO framework with looking at the population of operative hip fracture patients. And we would have 3 intervention arms, the nutritional protocol or nutritional arm intervention, training intervention, and a combination. And we would compare them to standard of care, as mentioned before, or mobilization, range of motion, or just no intervention. And primarily, we would like to look at mortality, but seeing the literature, there is a huge need for good quality trials. And we would really like to have a couple of secondary outcomes, good quality secondary outcomes. And we hypothesize that implementing these novel evidence-based protocols will improve patient care in this group, with the implication of improving care for this very fragile patient group. So to summarize, we have 3 ongoing projects, mainly focusing on the first one. And we have a very ambitious aim of submitting it in September. And we really would love to submit the second one also this year. And seeing the results from the first 2 projects, we would like to submit the third one next year. And I would like to end my presentation with a reminder from Aristotle that the purpose of knowledge is action, not knowledge. Thank you for your kind attention.
Thank you very much, Daniel. Any questions from the audience?
Thank you very much for your presentation. I would like to ask you from your third project, what exactly do you mean by nutritional protocol?
Yes, very good question. Thank you. We still don't know exactly. In short, this is why we're doing the first 2 mainly. And this is just like a motivation also for my team and I. I would really love to implement it or translate our knowledge into the clinical practice. And this would be a really nice way of designing a protocol. And hopefully we can implement our knowledge and, well, we need to see the results. So, but I'm really hopeful we will find some nice ways to improve our current guidelines or practices. And then we can start with designing this clinical trial protocol. So in short, we don't have the exact nutritional protocol yet.
Thank you. Yeah. And just for more questions about the second project, you mentioned a lot of micronutrients and vitamins. Like, do you plan to analyze them in combinations as well? Or like, how many are you planning to analyze?
Well, we would like to analyze the most relevant ones. It's a good question. I think while we're doing the data extraction, some will arise and we can focus in on those. But I would really like to see the whole plate. And we borrowed this from previous studies and here at the CTM, these nutritional studies. So we're in, one of my co-investigators is also doing nutritional studies in the last few years. So I had a lot of help from them. So this is how we built this nutritional domain.
Thank you.
Yeah, thank you.
Any questions from the right side? Back side?
Thank you. congratulations. I think it's a very interesting topic. And my question is related to your first project. I would like to ask what were the physical training protocols, and I wonder if they were standardized.
Very good question. This was, well, this is one of the banes of our data extraction also in the whole study, that while we were extracting, we saw that we will have a huge variety. So maybe they call themselves, for example, they're doing progressive resistance training, but then in actuality, it's like, okay, 3 times a week, one is doing 4 times a week, and then one. So we have protocols in these randomized controlled trials, they're described, but I cannot give you an easy answer because there's so many, so we need to standardize somehow, and this will be, well, this is already a major task with which we discussed with statisticians already a couple of times, so yeah.
Do you have any idea or hint, like how will you do it and what is the best to do it? How to proceed with that?
I think we will need to have ranges, and but I would really not go too much into the detail. I would leave it to a statistician. So if once we see the whole data table, really, because
thank you.
Yeah.
Thank you for your lovely presentation. You are done with 90% of the data extraction now, and I would like to ask. I may have missed it. Will you do subgrouping somehow between the?
Yes, we have many options for that, and we have many. So this also could be a network meta, maybe, or so. There's many possibilities. I would really not jump to those conclusions before we see the whole data, and I have a professional opinion, but I have a feeling that yes, we will have many subgroups. So just considering the age, because if you look at fractures, of course, like maybe it's an easy thing to observe that ankle fractures are more often happen in younger patients. Perhaps hip fracture is more an elderly thing. So we will have age. We will need to look at age. We will need to look at the training types and the fracture types, and then even within the same so-called same training types, I think we will need to differentiate. So, but we have quite a few articles, so I'm really hopeful that we will still be able to have good results.
Thanks.
Yeah.
Do we still have time for a question? Hi, thank you so much for your presentation, Dániel. I was wondering if you have any implication for the future for the first project. If you have I know you don't have results yet, but let's say physical training does improve the outcomes. Is there anything that you would want to change in the protocol, and when can you implement this change, let's say?
Yes, thank you for the question. That's the main motivation. I mean, I generally hear for most of us, I think that we would like to improve patient care and translate this knowledge. So I would say most like ASAP, so as soon as possible. But of course, as András also said, I'm just a resident. So, you know, like we need to convince people and we need to see the results. So yeah, I think if we would have a really nice protocol, so the third project, and we could show that, or I could show that, that could be quite convincing. So I think next year, maybe earliest.
Thank you.
Yeah,
Dániel, a rhetorical question.
Yeah.
Why is this not a network meta-analysis?
It can easily become that.
I think it should become that.
Okay.
For your third project as well, so that it helps your third project, so you're dealing with the most likely to be the best intervention in your third project.
Thank you.
Thank you so much.